I'm Elvia Limón. I am the engagement producer here for the Texas Tribune, and I want to thank everybody for joining us for a conversation on the next phase of COVID-19 in Texas. Hi, Karen. How are you?
Hi. How are you? Good. Thanks.
Before we begin, special thanks to Blue Cross Blue Shield of Texas and Methodist Healthcare Ministries of South Texas, Inc. for supporting this event. And for everybody watching, if you haven't already, make sure to follow Texas_Tribune on Instagram and at Texas Tribune on Twitter and Facebook. Today, I'm joined by Karen Brooks Harper. Karen reports on health and human services for the Tribune. She arrived in Texas in 1995 to join the Corpus Christi Caller-Times, spent several years in Laredo and Mexico covering immigration and the drug war for Night Rider newspapers, and has covered Texas politics for more than 2 decades for news organizations including the Fort Worth Star-Telegram, the Dallas Morning News, and Reuters. So let's get started because I know a lot of people are joining us and we have a lot of questions. So Karen, can you give us a recap of what's currently happening with COVID-19 cases, hospitalizations, and deaths in Texas?
They're all going up, with the exception right now today of the average new deaths that have stayed the same, but they're up, today, but they're up since last week about 15%. So deaths are starting to creep up too, although not as high as they would have been had 44% of Texans not been fully vaccinated. So what we're seeing is what they're seeing nationally, which is a spike in hospitalizations to the tune of, a 50% increase just over the past week. Almost 5 times as many hospitalizations we saw at the beginning of July, which has just been about a month. And then we're seeing average new cases spike drastically, up about 92% since last week. And here, just like everywhere else, the Delta variant is very much being blamed for that. What you won't see climbing as high and as fast is the death rate, like I said, because the vaccine is very effective against the Delta virus the Delta variant in terms of reducing severity of the illness and preventing death. So while we're seeing breakthrough cases of Delta variant, we can talk about that whenever you're ready, those people aren't being hospitalized.
Well, let's talk about it now. I mean, how do variants happen? We keep hearing about these different variants that are coming up in the last couple months. And why is the Delta variant of the coronavirus more concerning than past variants that we've seen?
Well, to try to keep it in simple terms, because that's how I have to understand it too. Variants happen when the virus is in circulation long enough to start mutating, like a very quick form of evolution. I'm sure a lot of our viewers understand what evolution is. Basically, the virus is trying to outsmart the vaccines and the things that are being thrown at it, or not the vaccines, but like the medications, the hosts. I mean, it's trying everything it can to continue to survive, while humanity is trying everything it can to tap it out, right? So what happens is that it goes, sometimes mutations of a virus in other cases will get, less severe. Sometimes they get more severe. Sometimes they become vaccine resistant. What we're seeing now is the Delta variant so far is the most contagious, the most infectious, and we're not seeing, and by we, I mean those of us keeping up with it. I'm certainly not doing the research, but what we're not seeing is a significant spike in the death rate of Delta, but it is producing some very serious cases, which is why you're seeing all these people going to the hospital. I mean, at Parkland Hospital, for example, in Dallas, there's just about 100 people in the hospital with COVID, and there's 20 of them are in ICU. And across the board, 95 to 99% of these hospitalizations are unvaccinated people. That's another. So the Delta variant really is ripping through the unvaccinated population. It's more infectious among the vaccinated population. It's way more likely to cause hospitalizations of unvaccinated. And one of the researchers and medical experts at UT Southwestern told me not too long ago that this virus needs unvaccinated people like a fire needs wood. It just can't really burn. If there's no place for it to go, it can't mutate. And what they're warning me is this is not the last variant we'll likely to see. I mean, there's going to be something that comes after Delta, particularly if the vaccinations don't, keep going up.
So you mentioned just unvaccinated people are the ones who are mostly being just affected by this. So can you tell us a little bit more about you mentioned Parkland. So what have other health experts told you that they're saying right now when it comes to unvaccinated people?
You know, the gamma is already in circulation, by the way. One thing I forgot to mention is that there is something that has already come out past Delta, but what we're talking about is something as big and as unsafe. And I forgot to mention that a minute ago. But in terms of, generally speaking, what the hospitals across the state are seeing in terms of unvaccinated is that the vast majority of hospitalizations are unvaccinated. And so, for example, we're seeing a statewide average of in the neighborhood of 15% of ICU capacity being taken up by COVID. That's going to fluctuate per market, but consistently I'm seeing 20%, 30% of ICU beds being COVID patients in various. So it's very serious.
So can you talk to me a little bit about vaccines? People are hesitant. So are they safe? Like, how do we know that they're safe for anyone who might be hesitant? And why are some Texans just just hesitating to get it? What have you heard from experts?
Well, the prevailing attitude among experts is that it's perfectly natural to have questions and to be concerned, about something that you haven't been hearing about your whole life, and that they're there to answer questions. The research is, and we've been doing this program, the research has been going on for over a year. It's been open to the public since December, and they still are very confident and very clear on their research that it is safe. It is still highly effective. You can see how the numbers just started dropping drastically in the spring when everybody was getting vaccinated. They are still convinced that the vaccine is safe. There's no evidence that it's not for just the vast majority of people, and that it is effective. It's still keeping people from dying. It's still keeping vaccinated people out of the hospital. Now the question everybody has is on breakthroughs. And I don't know if you want to talk about that, because that does kind of feed into some of the people wondering if they should get the vaccine, if they can still get infected. Do you want to go into that right now? Or?
Yeah, go ahead.
Yeah.
Because I actually, I have seen a lot of cases, well, not a lot of cases, but some cases here and there saying that there are breakthroughs. So what's the difference? I mean, if you get the vaccine, like how does that protect you for anyone who's having second doubts?
Just like the flu vaccine, it doesn't, the vaccines don't necessarily guarantee that you won't get it. They are still saying, as of, as early as yesterday, that the vast majority of new infections are unvaccinated. It's much more effective, at reducing viral spread. But it's not entirely effective at reducing viral spread. Breakthrough infections will happen. You'll test positive. If you're vaccinated, you most likely won't have any symptoms. The percentage of the breakthroughs, like somebody just pointed out, and I was just about to say that too, the percentage of breakthroughs is still extremely low. But they've never ever said that you can't get infected if you are vaccinated. What they've always said was that its best protection is against severe disease or death. It's important to keep communicating the facts as we know it, because people do have questions. And if only 44% of Texans are fully vaccinated, that does mean that there are people that aren't convinced that the vaccine is safe. So, that's one of the messages that you're going to hear, and you're going to hear the media talking about it and the state officials talking about it, that the vaccine is safe, that there is hesitation, whether we want to admit that or not. There is a very large population that is hesitant. There's a smaller population that's lacking access, but most of it is, most of the new infections are unvaccinated. Make no mistake about that.
So can we talk about how the Delta variant affects adults versus children? What are some of the things that you've heard?
We are hearing, yeah, we are hearing that there's increases in hospitalizations among the children. I haven't heard of any. I haven't heard, and now, it could be out there. So I'm going to qualify it by saying there's a lot of stuff out there and it changes every day. The last I heard was that because of the spread, there are more children going into the hospital. As far as the rate of infection, I mean, the rate of severity, it doesn't seem to be much different. There's not a lot of evidence to support that the Delta variant makes you sicker. It's just more infectious. It's easier to catch. And in terms of the children, there's nothing any more alarming about the way it can infect kids than in past, variants. However, because it's, 7 or 8 times more infectious than the original coronavirus, you're going to get a higher number of kids getting the infections, relatively speaking, which is just going to translate to, more numbers in the hospitals. But as far as how it affects kids versus the last one, we're not seeing any, I'm not hearing about any evidence that says it's any worse in terms of severity.
So I know people have been talking about just what state leaders are, in the comments, what state leaders have been doing. So like, what have top Texas officials, what have they been doing? How have they responded to the increased number of cases in the past few weeks? What's happening in Texas?
There's not a lot of stuff that the leadership is doing other than saying what we can't do, which is they can't mandate masks at school districts. They can't mandate social distancing. They can't have funding for across the board online school. They can't require people that that work in government buildings to mask up. They're not allowing governments to do business restrictions or limit capacity to 75% or whatever Austin and Harris and those guys want to do. They're not letting them do that by and large. Now you're going to see cities do it anyway. Like we're seeing Harris County do some of that anyway, and we're seeing school districts not mandating it yet that I've seen, although I might be missing a smaller one or something. But for the most part, they're going to rebel, and then they're probably going to get into some kind of litigation if they try to mandate something and people complain about it. But it's voluntary for now, and really the most movement we're seeing right now is the employers requiring their requiring their employees to get vaccinated. So we just saw Tyson, which has several plants in Texas, requiring their admin staff to do it, and that would probably go into their meatpacking plant employees as well, although they have a pretty high rate of vaccination. But you're seeing a lot of the hospital systems starting to require their people to be vaccinated. And so, really the most movement you're seeing is on the part of businesses because the governments can't do much right now. Their hands are pretty much tied by Abbott and those directives. Mm-hmm.
So now going back to what health, we talked about what Texas officials have been saying we can't do. So what are health experts advising that Texans should do now that these things are voluntary to protect themselves from COVID-19?
Yeah, what's being recommended and strongly encouraged by the health experts is, number one, get vaccinated, right? If you're not vaccinated, they're saying you definitely need to get vaccinated. That is still the most important thing, and the best thing you can do to keep yourself safe and to keep those around you safe. That, however, won't stop the spike that we're in, because it takes anywhere from 2 to 6 weeks for those vaccines to be effective, depending on which course you go. So immediately, keep washing your hands, keep wearing your masks. That's what they're telling us. Even the ones who are vaccinated, if you're indoors in a crowded setting, wear your mask. Don't pick it up unknowingly and put it to, and bring it home or bring it to somebody who's not vaccinated or who is at risk or something. So, keep your mask with you. Vaccinated people have more freedoms, according to the CDC, which is what, the guiding science on this. They have more freedoms if they're vaccinated, but the masks are still going to be the best way to stop the spread in the short term. The long term, it's still vaccination. But you know, we've been doing this for a year, so this is not, you know, this is not unlike the things that we've already learned to do and have become habit. For most of us have masks in our car probably at this point. You know, I was talking to Chief Nim Kidd, who heads the Department of Emergency Management, or the Division of Emergency Management for Texas, the other day, and he said, you know, he's obviously vaccinated and he keeps masks in his pocket. You know, he wears them still inside, and so this is, you know, just keep doing what you're doing. If you're vaccinated, you can move around, you can see people, but you know, mask up if it's in a high transmission, you know, situation. We are a high transmission area in Austin and in most of Texas. So
we had several people actually ask. We had a lot of questions ahead of today's event. Asked if they should be limiting their public outings or returning to quarantine behavior if they're vaccinated. So that's kind of related to what you were talking about just now. So like you mentioned that vaccinated people have a little bit more freedom. So for anyone who's thinking this, like, should they be limiting their public outing, or should just they be masking up, or what should they be doing?
You know, the people who are vaccinated, you know, I haven't heard a lot of people telling them to limit their outings. You know, I mean, that's kind of a personal comfort level. You know, when you do go into a restaurant, you know, or when you do go to, you know, you are around unvaccinated people or around a crowd of people, maybe if you're at a, you know, at a live music event or, you know, something like that, indoors, mask up. You know, maybe at the grocery store, if it's crowded in there, you know, you might want to mask up. The breakthrough cases are rare, and they're mostly asymptomatic, but they can make you sick. You know, I just spoke with someone just this morning, a hospital administrator whose wife is vaccinated but did test positive. They're going to put her on the, you know, on the infusion treatments to make sure that she doesn't get sick, but she's not sick as of now. But they're not taking any chances because you can get, just like when you get the flu through the vaccine. I remember maybe 2 years ago when we had a flu. We didn't have a flu last winter, to, you know, for all intents and purposes. But in 2019, the warning was, take the vaccine. You'll probably get the flu, but it won't be nearly as bad. And that's common. And that's kind of the message, you know, that's kind of the message that we're hearing right now.
I see that Judy R. Williams asked in the comments, are we keeping track, is Texas keeping track of breakthrough cases, or do you know if they are or not?
If they are, the hospitals aren't being required to report that. I don't believe still, at least they weren't as of a couple of days ago. So there's not a reliable statewide number, but I know that a lot of the local jurisdictions are, you know, are keeping track of it. So for example, Bexar County can tell us with authority that 99% of their cases are unvaccinated. Or hospitalizations are unvaccinated. In cases, you asked about cases. I just got confused on hospitalizations. You asked about cases. We don't have a really good tracking of it because of a number of limitations on that. But what we are hearing from the nationals who are studying this and the CDC is that it's a lower volume. And there's a lot of people who are vaccinated who may have a symptom or may have no symptoms and have no reason to get tested. So it's kind of hard to track that as well. But so far, what the nationals are seeing is a very rare number of breakthrough cases. But, you know, that's as good as the data that they can collect. So
one of the last questions that we have, if you receive one dose of the J&J vaccine, can you receive a booster shot of Pfizer and Moderna? Can you talk a little bit about just booster shots in general? What are health experts saying about that?
The booster shots, so far, the health experts are saying people don't need booster shots right now. The vaccines are continue to be effective. There's no pervasive and widespread evidence that they're declining in effectiveness already. We've only been vaccinated for a few months. And so right now, the Delta variant or any other variant is not causing them to really push for a booster shot right now. You know, it may need to happen later. They're watching the numbers, they're watching the effectiveness, they're continue to do the research. Now, what I will say about mixing them up is that the CDC's guidance is not to mix them up. They don't particularly have any evidence that says there's a negative effect, because the vaccines aren't showing, a high number of negative effects. They just haven't done it. That's not how they're recommending that it be done. They just don't, and the last person I, saw talking about this not that long ago, was, if there was, there's just not that much research on what happens if you take a Johnson & Johnson and then 2 weeks later take a Pfizer and then 2 weeks later take a Moderna, or whatever the hypothetical situations are there. What you really need to do is just stick with the protocol. That's the way they were tested. That's the way they were safe. There's no need to get, they're all, similarly effective against preventing disease and death as each other. So there's really no reason to mix them up right now.
I think those are, I know someone asked in the comments, and you mentioned this, LQTX, would I be at risk of long-term heart, cognitive, and lung issues through a breakthrough infection, even if my initial symptoms are not serious? Do you know, have you heard anything about that, or is there just not research right now, or what have health experts said?
Specifically for breakthrough infections, the only discussion I've heard about that really, which is telling, because if it was still putting vaccinated people at risk of long-term from infections, we would be hearing more about that. And I've sat in on some of these advisory committees lately, and they're not really discussing that a whole lot. But what I am hearing is the same, things that they've learned throughout the last year. If you had a serious infection, the long haulers are more likely to be those who had a serious infection to begin with. Didn't have to be hospitalized, and that's a fair question. But I haven't heard of vaccinated people being subjected to long-term conditions. But then people have only been vaccinated for a few months. So, usually those long-term effects are in more serious infections, based on what I've heard and learned so far.
Judy missed who you were, Judy R. Williams. So we're currently talking to Karen Brooks Harper, who's the Tribune Health and Human Services reporter here, Judy. So I just want to make sure that you know. One last question that I have that I forgot to bring up earlier, from SB Brute, who asked ahead of time, how far does Governor Greg Abbott's powers reach for setting COVID-19 guidelines? So I know you mentioned that some municipalities might just defy his orders and what he's put into place right now, and they might end up in the court system. So how much power does he have right now?
Well, he's got some considerable power during a disaster declaration. While the pandemic is going on, he can enact any of the things that he enacted, last year. He can issue executive orders banning, the municipalities and the districts from doing things. His lieutenants, like the head of the TEA and those guys and the commissioner and everything, can do things that affect how locals handle, and respond to it. The Texas legislature, did some of that too. They banned vaccine passports, and so he can do stuff. He can say tomorrow, he can lift the ban and say, districts, you guys can do whatever you want. But and then they can do it without fear of legal retribution. If they do it anyway, whether they can enforce it is questionable, against Abbott's word. Certainly the Texas Attorney General Paxton will try to do his best to enforce Abbott's ban through legal action, which he's not shy of doing. He does that a lot. And so he's got considerable power. He could affect this fairly quickly, just like he was doing last summer.
Okay, well, with that, we're out of time, but I want to thank everybody for tuning in. And I want to thank you, Karen, for joining us today. And for more coverage, get the latest and most important Texas news at texastribune.org. And be sure to join us for the Texas Tribune Festival, taking place virtually September 20th through the 25th, and in person on the 24th and 25th in downtown Austin. There we'll talk through the latest of everything that we cover in this live discussion and more. So buy your tickets at tripfest.org. Thanks so much, Karen, and thanks everyone.
Thanks, you guys.
All right, bye.
Bye.